The following segment is sponsored by Pain Relief Partners.
Welcome back to AM Northwest. If you have chronic pain, there are several insurance-covered therapies that could help you find relief. Here to share more about them, we welcome back from Pain Relief Partners, nurse practitioner and owner, Stephanie Jones. Good to have you with us.
Thank you.
So first of all, let's talk about some of those therapies that are covered by insurance and why they're important.
Yes, so we have several injection therapies in the office that are covered, and probably the most common is trigger point injections.
Explain how that works.
Yeah, so a trigger point is just something, maybe in the back of your shoulder or your neck, in your back, your glutes, that is a knot or a just bound up area that's really tight, and it's painful. Maybe it pulls your shoulder forward or back, or hurts to turn your neck. You can't quite get that range of motion.
Right.
And I inject into that area with local anesthetic. And that does a couple of things. The local anesthetic will use vasodilates, meaning it opens up the blood vessels and gets more blood into the area.
Okay.
And of course, the blood is what carries the oxygen and nutrients and allows for more healing. And then because it's an anesthetic, it helps to relax that muscle, and that allows for more comfort for the patient and more function.
Oh, that's great. And then you mentioned two other therapies.
Yes.
Other injection therapies.
Yep. So we also treat a lot of neuropathy, and it's covered by Medicare, which is wonderful because as we get older is when you tend to start to see neuropathy symptoms. Of course, there are younger patients who have that, but it's wonderful to have a Medicare covered procedure. And what that is an ankle block, and there are 5 main nerves that supply the foot, and I'm able to see those on ultrasound. And so the patient comes in and either sits down or lies down on the table, and I assess their feet, check to see what sensations they can feel. With neuropathy, sometimes you can't feel sharp or dull, you can't tell what's cold or hot. And so we test that each treatment to look for improvement, and then I inject in 3 places on the foot under ultrasound guidance, and that's again with local anesthetic. And so that also is sending more blood into the foot. Often with neuropathy, one of the main problems is a lack of blood supply into the feet. And so when that happens, the nerves can't function like they need to. And so if we're able to get that blood flowing back into the feet again, patients can get some sensation back.
And you have other things that are covered by insurance as well, like chiropractic care, right?
We do, yes. So we see a lot of patients for chiropractic care, and Dr. Kessinger is fantastic, and he's been using a new therapy that we're really excited about called zone therapy, and he is one of a few providers in our area who uses that. The next closest are Eugene and Yakima. So,
what is zone therapy?
So he actually feels the back of your skull, and there are 6 different zones that he's testing, and he asks you which one is the most tender, and they feel different also to him when he's assessing.
Right.
And then based on the area that's the most tender, that actually tells him which parts of your spine to treat. And then he uses a very gentle tool. It's called an arthrostim, and it's just a little tap, tap, tap along the spine. And that allows for a very gentle and effective adjustment. And then he rechecks those areas to see if the tenderness is gone. And 9 times out of 10, it's gone with the first adjustment. Sometimes he repeats to really get that to go away. But patients have loved it. He's only been doing it for a few months, and it's made a huge difference for our patients.
So when someone comes in and they have their insurance with them, you can figure out what they're able to get covered and not covered, right? Pretty simply.
Yes.
Sometimes insurance is a little difficult.
Of course. So we take a copy of their insurance card when they come in for the free consultation. So they actually get to meet with Dr. Kessinger, and then we will check their insurance. And if we're able to, tell them that day. Sometimes we need to wait for a day or 2 to hear back from the insurance company. But we're able to tell them this is your cost for this procedure. You have your copay, and then perhaps a 20% co-insurance or whatever their case is. And we can give them an idea of the cost and what the treatment plan would look like.
That's fantastic. And it must be great to see someone walk in not feeling so great, but walk out feeling pretty good.
Yes, we love it.
Yeah, that's awesome. We want to tell folks, if you'd like to find out more about Pain Relief Partners, they're located at 406 Southeast 131st Avenue,
Suite 203.
Suite 203. I knew there was a word, I couldn't figure it out. Suite. I knew it was an apartment. Vancouver 360-975-4680. And we'll put that information for you on our website at katu.com. Stephanie, thank you very much.
You're very
Appreciate
welcome.
it. We'll be right back with more AM Northwest. Don't go away.